Hello, my name is Chantel Lacey, and I'm a student nurse. I'm here today with my patient, Mr. Brian, who's a 43-year-old male who has just had a colostomy appliance applied to his left lower quadrant. He is 3 days post-op from his surgery, and he will be leaving on tomorrow. So I'm going to be giving him education for self-care for his ostomy since he's going home and while at home and how to do it the correct way. So I'm going to enter his room. I'm going to introduce myself. I'm telling him what I'm here for. And I have already set the room up with everything that I need previously. So there's a basin of water, a cylinder, an extra pouch. He has the two system pouch with a Velcro closure. I have trash can receptacle nearby. I have him placed on a a water resistant pad or a towel that's nearby. There's also a warm bottle that can, a squirt bottle that contains warm water on the table. So yeah, we're gonna go in. So I'm in the room. I perform hand hygiene, and Brian knows why I'm here. So I give him privacy with the curtain. He's in the private room, so the door's shut. So basically, Brian, today I'm just going to educate you on your ostomy bag. Your ostomy appliance and the importance of keeping it clean and dry and the reasons behind, making sure that it clicks in place and show you how to care for it. And if you have any questions at the end of this education talk through today, just let me know and I will ask you. So let's get started. So you have the drainable two-piece system appliance with an adhesive backing and a faceplate that clicks in place. This appliance gets changed every 3 to 7 days, and you must empty it when it's 1/3 the way full, which helps reduce the risk of leakage and odor. And we don't want to have any, embarrassing moments. So it's best to empty it when it's 1/3 of the way full versus letting it get all the way full and it can bust on you on accident if it's not done, if it has too much air in it. Those little things can happen. So right now, I know you've been looking at the stoma and viewing it, and all that's normal. So the color of your stoma right now is dark pink to red in color, which it should look like that, and it should always be moist. It's going to protrude a 1/2 inch from the abdominal surface until the swelling goes down from the surgical site. Your periostomal area has to stay clean and dry, which helps to reduce irritation to the skin. It helps reduce the risk of infection, and it helps to reduce erosion that you may have with your skin. It's very important that you notify the PCP if you have any bleeding or any abnormal color changes to the stoma, such as dark purple to blue, because that can mean that it's ischemic, which is not getting proper blood flow. And it also can mean that it could be anemia somewhere along the line. So we're going to start by allowing you to perform hand hygiene too. I'm donning my gloves. And I'm going to start by placing a towel underneath the absorbent pad that I have right here underneath your left quadrant side. And I'm going to unclip the faceplate away from the adhesive backing. because we're going to leave that in place, being that you just had it done, so we don't have to really change the adhesive backing at this moment. Which you could probably do that on the 6th day. That's why we're showing you this now. So when you get home, if you feel the need to change the complete system out, that's perfectly fine. So I pull away the faceplate and I clean the stoma with warm water, wiping it down using a different side of the washcloth each time. Try not to irritate it or rub it too hard. I'm going to take the bag appliance and I'm going to unroll the Velcro and empty it into the cylinder to clean it, and then I'm going to rinse the bag out by rinsing it with the rinsing it with the warm water that's in the squirt bottle. And I have the basin there to allow that extra water to flow into. The stomach looks good. It's not irritated or anything like that. So I'm going to dry off the end of the bag from where the stool went through, and make sure that's nice and clean and dry. And I'm going to pat around the stoma area to make sure there's no extra stool there. And then I'm going to clip the appliance back in place, and you just use a little firm pressure and you just push. You should hear a click. If you do not hear a click, that means it's not secure, and you just have to make sure that it's secure so that you don't have leakage. If you do decide to change the whole appliance out, then we will just take the faceplate off. You can discard that into the trash receptacle in the trash. We would take the adhesive backing off, and you will basically push your skin away from the adhesive backing with light pressure. We're not going to pull the adhesive backing off of your skin because we don't want to cause further irritation to your skin. So you're going to push the skin away from the adhesive backing as we go around into a circle to get it off the square part. Once we take that off, we're now going to clean the stoma using fresh warm water and a soap cleanser, nothing too harsh. And we're going to wipe from top to bottom top to bottom in a circular motion around the stoma. We're going to pat that dry, and we're going to let that dry, make sure it's nice and dry, because then we're going to have to apply a skin protectant around the stoma, 2 inches in radius around the stoma, so that it's protecting your skin from any irritation that may occur. We're going to use the stoma tool to measure the size of your stoma so that we can cut the adhesive backing to the appropriate size of the stoma so that it lays comfortably over it without irritating it. And we want to make sure there's no jagged edges of that sort. If so, we want to cut them off and make sure it's nice and smooth. We run our finger around the part that we cut. So it measured perfectly. We're going to measure 1/8 of an inch larger than the stoma size that we measured to give you the extra room that is not irritating the stoma. Then we're going to peel back the adhesive backing. We're going to place that on there firm, hold it so that it sticks, and then we can clip on the faceplate to your 2-piece appliance that you're having. And you have the Velcro closure, so we're going to roll that up, close it, have it securely in place, and I'm going to perform hand hygiene. I'm taking my gloves off. I'm helping Brian back into a comfortable position into bed, and I'm leaving him with extra information of pamphlets for care for the type of appliance device that he has. His call light is in reach, and if he has any questions, I'm glad to come back in to answer them for him. When his family picks him up, I will make a note that if he needs further information left for them, or if they want to be included on the educational part one time before he leaves, just to go over everything in the morning, then that would be fine. That would be great, and we would be glad to help him. So yeah, so he's resting, and I perform hand hygiene. I'm leaving the room, and I cleaned up my mess or discarded everything that I used to help him with his self-care ostomy once he goes home for discharge 3 days post-op of his surgery. Thank you. And that's basically cleaning and emptying the ostomy, colostomy for a patient who who didn't have any, who has been educated yet. Sorry. So, yeah, thank you for listening, and see you guys next week. Bye.